Alright, hi everyone, it's Julie, and I have another update to make for you guys. So, my doctor's appointment was on September 27th. I believe it was at 10:30 in the morning, but that doesn't even matter. So, I went there to have my confirmation done, and that was done. I went in there, got my blood pressure taken, everything was good. Blood pressure was even a little bit on the low side. I can't even remember what it was exactly, but then I got weighed, and they told me, that every time I come in, they're gonna do, some kind of urine test, and they did the pregnancy test there, which I was like, alright, whatever, but I don't think they did the regular urine dipstick that they do normally. And so then, because my cycles were really irregular, my doctor wanted to try and figure out exactly how far along in my pregnancy I was, and all that good stuff. So, and I had asked about getting a beta HCG test to figure out what my HCG levels were and all that stuff. And she said that one wouldn't give like an exact timeline because, it kind of varies from person to person, what's normal and whatnot. So anyway, so she ordered an ultrasound, which was cool, except for the fact that I didn't know that they were going to be doing that, so I didn't bring my husband with me. And I was a little bit disappointed at that because I wanted him to be there for like all the ultrasounds and that kind of thing. So when I got in the ultrasound room or whatever, it was an internal ultrasound, which I figured it would be. Anyway, so I go in there, and the tech, I know she must have been kind of stressed out because she was the only ultrasound tech that was in the office that day. So she was obviously really busy. There was a lot of women in there. So, she asked me about how far along that I thought I was, and at that point it was 7 weeks and some odd days. I don't even remember for sure. But anyway, yeah, so she was like, and when she did that, I was like, oh my god, and I could see the, the gestational sac and that, and, but she ended up telling me that she didn't see a yolk sac or a fetal pole, which right then, because I'm not a complete idiot, I kind of know what's supposed to be there, like I have a general idea. I'm not an expert or anything. So when she said that, I started to kind of freak out, and my heart started to race, and, so, she did what she needed to do, measured, whatever, and then, I got dressed, and they told me to have a seat out in the hallway, and then I'll get called back again, where the doctor will go over the pictures with me. Okay, I gotta make sure my camera is still on. So yeah, and I was so anxious, like I started to cry, because I was just thinking about, she said she didn't see a fetal pole or a yolk sac, and that kind of made me think that something might be wrong with the pregnancy. Anyway, I'll show you the picture here in a second. Let me just, okay. Alright, here, I'll show you a picture. So, here it is. It's up there. Yeah, so my appointment was at 10:30. I didn't get my ultrasound done until like an hour later. But anyway, so there's the thing. I know this this stuff around this part of it is the endometrium, and it's bright white, and it's really thick, especially at this bottom part here, and that's a really good thing. I don't know about all the other little white dots in there, but yeah, that's obviously this gestational sac. This whole thing, I guess, is my uterus or something. I don't know, because I was like, where's my uterus? And then I guess my ovaries and stuff are like up here or somewhere. But anyway, yeah, I think where baby is going to end up being is in that top right hand corner. Well, it is my right anyway, so up up here, I think. I don't know, and I think maybe placenta down here, but I don't know what that random spot there or there is. I don't know. So anyway, I'm very nervous because I guess from, you know, the ultrasound picture and everything, I'm not as far along as I thought I was, because I was kind of going by the first day of my last menstrual period, which was August 7th, and but I made that video when I got my positive ovulation test, or actually I think it was a couple days after I got my positive ovulation test, and that was September 1st. So obviously that's a big difference. So she thinks, since I did get the positive ovulation test on the 1st, that is probably when I conceived, and that would put my due date, like, I don't know, instead of May 13th, it would kind of put it somewhere in the May 20 days. From what I've gotten online and stuff, I've gotten anywhere from the 24th to 28th, so I don't know, somewhere in between there. Not that it really matters that much anyway, because, I mean, not that many babies are born on their due dates anyway. So, okay, because today is October 3rd, I believe. Yes, because tomorrow is my sister's due date. So that would put me, based off when she thinks I conceived on September 1st, so that would put me today at 6 weeks and 4 days. From whatever date that I used. I probably should have written it down. But, yeah. I still have the same exact feeling. I have the cramping, that kind of feels like period cramps almost. I have not spotted at all, and I'm very happy about that. Everything's been fine. I haven't well, I've gotten pretty close to throwing up, but I didn't, mostly just because of smells. And I've noticed my stomach is pretty sensitive. Like, I made tuna helper, and I don't know what possessed me to make it, because I hardly ever make any of the helper type things, but I made it, and it was good for like a half an hour, and then my stomach was like, oh my god, I hate you. So, so yeah, and that was kind of like, oh god, worst decision ever. But anyway, so I will be 7 weeks then on October 6th, based off, again, whatever due date popped up in whatever website's calculator. But I have another ultrasound scheduled at 8:30 in the morning on Friday, which is October 7th, and that would put me, again, on whatever date, 7 weeks and 1 day. So what I'm hoping for then is an official due date from the doctor, you know, saying, you know, based off of your measurements, you are, you know, this many weeks, this many days, and all this stuff. I just really want some reassurance, because the hardest thing to wait for is time, you know, and she's basically just said that there's nothing I can do until then, because, you know, she said, well, I asked her, you know, if that means that something's wrong, or if I'm just not as far along as I thought. Well, she said, well, I know you're not as far along as you thought, and, you know, there are no guarantees that it's going to be a healthy baby and stuff like that, at least at this point, because, you know, you are at the highest risk in the first trimester, and that was really hard to hear. I just bawled. When I got home, I bawled some more. But, I'm really hoping that everything's going to be okay. You know, I know I have lots of family members praying for us, and all that good stuff. Like, I've been anxious to start buying some little things here and there for baby, but then again, I'm afraid in case something goes wrong, and I have all of this baby stuff to remind me. I mean, it's hard enough, like the doctor's office, since, you know, they confirmed that yes, I am pregnant, and it's not just a fluke. They gave me a bag of stuff in there, and I had like a sample of like a little newborn diaper, which was like so cute and little, and it had Winnie the Pooh on it. It had the little umbilical cord cut out, and I had like some breast milk storage bags, and, you know, just all this stuff. And I was just like, oh my god, like, you know, if something's wrong, then I'm gonna be a mess, honestly. But, yeah, so that's where I am, 6 weeks and 4 days, based on whatever. Could be a little more, could be a little less, I don't know. But, if you could all keep me in your thoughts, that would be amazing. And so I hope you all are doing good. And I'll see you again soon, and I will leave you with another shot of the ultrasound picture. One of these days I'll figure out how to do like a belly shot, or where I can even set up the camera and stuff. There's really nothing there. I just look bloated. Probably because I am. Anyway, I'll leave you with a shot of the ultrasound picture. Ooh, I didn't know this video was over 10 minutes long. So, I don't know if those numbers like in the corner really mean anything, like the, I don't know, like 3.5 centimeters. I don't know if maybe that's just supposed to be how big this sac is. I don't really know. Anyway, that's it. Hope y'all are doing good. See you again soon. Bye.